stash. It's gone. Do a full swing. Alright, Josh, your turn.
I'm good.
No, you got to.
No.
It's the new clap.
No. It's fine.
Full face swipe.
Sorry, go ahead.
Hey everybody!
Hey everybody.
Hi!
We're not doing like a harmony join in.
Last time we tried that, you wrote it, so we're not doing that ever again.
I started it though.
Nope.
I was like, hey everybody. No?
Nope.
You guys suck.
Yeah, we suck.
Yeah.
Yeah.
We're the problem.
You
Oh, I
suck.
have my branded drink cup visible. Hold on. Okay.
Do we just start over?
Nope.
Garen live.
You may notice we're back in the studio.
And
Yeah,
been a while.
we were able to get together.
Have you
For
missed it as
once.
much as we have?
Despite our busy schedules. And for
Despite
those
our
of you
differences.
listening, everyth's the same.
Probably, except that it's gonna sound different.
we have been very busy though.
We have been very busy.
Life's been busy.
Life's
No one told you life was gonna be this way. Again, Ian. I did it even slower so you would catch on the train quicker. Alright, what are we doing today?
I wasn't 100% sure that's where you're gonna go. And then
when you say those words, you don't say anything afterwards. You do the claps.
true.
it's true, but I don't know.
Alright, well,
My brain to hand is a little
today
slow.
is just a bunch of failed bits, so what are we talking about?
Well, one of the things I wanted to talk about was insurance.
Ew.
Gross.
It's the first time back in the studio we're talking about stupidness.
And how it's a scam.
It is a scam. Okay, let's
Unless you want to have a silly topic.
jump
but
into
I don't see any of you bringing anything
we'll
to this
do it-
beanbag.
We'll do something next. But let's talk about this. It's a good topic. It's an annoying topic that we all hate. And is relevant in our lives.
So I did want to start with a game, and then we can have our discussion afterwards.
Okay.
What game can you bring out from this? Go
Do
ahead.
we need whiteboards?
No, we need the paddles.
Paddles. That's gonna be
But that wasn't about
Yeah. You're gonna hear that later.
Okay, so you're gonna hold up black side if you. What side are you? Are you showing
I'm
me?
just
or
showing both.
Okay.
Yeah, we're both switching.
Go ahead.
So you're gonna show the black side if you think the statement I'm saying is true, and you're gonna show red if you think it's false.
In my brain, that was opposite. Red was true, black was false.
But red is always wrong.
Yeah,
Okay.
that's what my brain said.
I don't know,
So
red
we're
just
on the same page.
Yeah,
Feels
yeah, yeah.
right.
For
Black
once.
feels black bad, red also bad.
Exactly. Anyways.
Okay.
So I have a list of misconceptions and little known truths. So misconceptions are the
Things that
the
are
false,
misconceived.
and then the little known truths are obviously the facts.
Sure.
So
Okay.
number 1, employer provided insurance is always the best option.
That's it.
I forgot which was good and bad.
Red is bad.
Red is bad? Okay. Okay. I did it wrong.
That is correct.
Yeah,
It
I-
is false.
I would say that you'd like to give you like the bare minimum most of the time, depending
Yeah.
on where you work.
Yeah. So so it says like some people assume that it's the best deal, but the marketplace plans can offer better coverage depending on your needs, and also sometimes a better rate too.
Well, because companies aren't going to give you the best stuff. They're going to give you the cheapest they can afford.
Mm-hmm.
What also depends on the company. Like bigger companies with more employees can usually bargain for better rates and stuff like that because it's a group plan.
Yeah.
But like when you're the purchasing power of one person, you might not have, or a smaller company of like 10, 20 people,
Yeah.
might not be able to get as good of a deal.
True.
Okay,
Okay,
number.
that one. Good job, Josh.
Oh, should I be keeping score? Give me a
Nope, doesn't matter.
Okay. Red is true.
Red
No.
is false.
Gosh dang, I can't get it.
Red is bad.
I'm not gonna keep telling you this.
Red is bad, black
Okay.
is good.
Number 2, all preventative care is covered for free.
Preventive care? I would say
Red is bad. Red is bad.
So that is true.
Really?
Or, I mean, like, you guys are correct.
Oh, okay.
Sorry.
Now you're confusing him more.
Sorry, I was trying to say
What do colors mean?
you guys are correct is what I was trying to say,
Yeah,
and then my brain substituted correct for true. But yeah, not all visits are considered preventative, and some preventative things could.
What constitutes
it's all
preventative?
Preventative is supposed to be like you're not sick right now. We're preventing any illness, but if it's determined that you were talking about something that like already pre-existed or whatever, that's no longer preventative.
Mm-hmm.
So, yeah.
All right. Next question.
Okay, third one. High premiums means better coverage.
Probably not.
Probably not.
Correct.
Yeah.
Yeah.
All I'm hearing here is that insurance is very like.
Yeah.
You're not getting
The benefits really are what matters. I think in most of the plans that I've seen, more often than not, higher premium usually correlates to a better tiered plan.
Usually.
But that's not always true.
Right.
Okay.
Okay.
Out-of-pocket costs can vary within the same plan.
Within the same plan?
Black is yes. I think that is true.
The out-of-pocket coverage could vary depending on the plan.
Mm-hmm.
The plan
On the same plan.
Oh, on the same plan? I would say that's false. I feel like it should be consistent for the most part.
So that is a fact.
Yeah, because it should be.
So while your plan covers different things, or you have like the same copays and all that stuff, different hospitals can charge and negotiate different rates with that insurance provider, so that can change stuff.
Interesting.
It's all arbitrary.
Yeah.
Number 5. Once you pay your deductible, all services are free.
Once you pay your
that's-
deductible.
I don't think that's correct.
I don't think so either.
You guys are correct.
Yeah.
So after meeting your deductible, typically you have co-insurance or co-payments that you have to pay until you reach your out-of-pocket maximum, in which case then your insurance will
You
kick.
see just how many
Well,
limits there
100%
are that
kick
you
in.
have to get to. You have to pay for insurance, and then you have to pay for your stuff until you reach a certain amount, and then you have to pay until you reach another limit, and then they'll start paying stuff for you. Like, it's so much paying before they even do a thing, and that's even if they agree, yeah, we can cover that. Because they still might not. They might be like, oh, well, we're not going to cover that for you. And then you still have to pay anyway, even though you're paying for insurance and you paid for all this stuff.
Yeah. That's...
It's the biggest scam in the world.
But we need it, apparently.
We don't. Not this system.
Okay. Number 6. Prescription drug prices can differ between pharmacies.
I think that's true.
I think that's true, and it shouldn't be.
It is true. Prices for the same drug can vary significantly, and sometimes pharmacy discounts or mail order options may be cheaper than using insurance.
Yeah.
So weird. Why do
Because
you have to be
we
competitive?
Because we care about money more than people.
Well, see, because capitalism and being competitive is supposed to drive prices down, but not when they all collude with each other to just be greedy.
Yeah.
Yeah. The free market doesn't account for greed.
It's not free when they're manipulating it from the top.
Yeah.
Okay.
True.
You can only get insurance during open enrollment.
I don't
would
know.
say
I
that's
don't know if
false.
that's true or not.
You're both going false?
Yeah, I would say that's false.
That is correct. Do you know what other... No, you guys are correct.
Oh, we're right. Oh, okay.
I'm only going to use the word true if the statement I said was true.
Okay.
But do you know what other things would allow you to be able to change your insurance?
Getting a new job.
Yeah. You stop using your...
Losing a job.
Yeah, you stop using your insurance. Job is that's a big one, yeah. That'd be...
Well, like, unrelated to job, what do you think are things that can happen in your life that would allow changes to your insurance?
I don't know, you get diagnosed with something, and now you need something else, so now you need a different plan or some shit.
No.
No,
That
they
doesn't
don't
matter.
care
They
about
don't care
that.
about you.
Okay, well that was my guess, so...
That's a good guess. But
Do you have a guess?
what in your life can happen? You get married?
Yes. So
that's good.
they consider qualifying life events like marriage, childbirth, adoption, stuff like that are times where you can adjust your insurance outside the regular window.
Isn't that also ridiculous too? That there's a specific time frame that you can change your insurance, otherwise you're locked into whatever you got.
But and also like my coworker, she
just got a baby.
I mean she did, and it is the same coworker that I'm talking about. But she turned 26 after working here, so that also counted as like a major life event because she now was no longer covered by her parents' insurance. So then she was able to sign up in like September, October, even though her enrollment's in July, August. So.
She's 26 and she just had her baby.
She turned 26 like last year or the year before.
Oh, nice.
She has 2 babies.
Okay. And we're over here childless, no dogs.
Living
each other.
Attempting to live our best lives.
Yeah.
You have mom and dad. Let's see, that was number 7.
Are your parents, I don't know, tangent.
Yeah, go for it.
Are your parents like wanting one of you guys to have a child? Like desperately?
Not desperately.
Not desperately. I think they would like to be grandparents, honestly.
Yeah.
And I think they see that in their future, but they're not in any rush.
Okay. I don't have the same issue because, you know, my brother had a child. But
Yeah. There are kids.
Yeah, like grandma was fulfilled.
yeah, grandma was fulfilled a long time ago. Anyways, continue.
And nowadays she does not want to be that involved with the baby.
No. She's living her best life.
Okay. So, you can negotiate your medical bills with insurance in the hospital.
The hospital. True. I would say true.
I was thinking the same thing, so I'm going to come in, but I don't.
I want to say it's true, but it's difficult as
It
hell.
is true.
Yeah.
Yeah. It's just really difficult to do because people
like, no,
So, many hospitals and providers are open to negotiating, especially out-of-pocket expenses or denied claims.
Yeah.
Not all services count towards your deductible.
That's true.
Yeah, I would say that's true too.
Correct. Certain non-covered treatments or medications may not count towards your deductible even if you're paying for them.
Which is, again, absurd.
Yeah.
That they're like, okay, you pay for insurance, but then you have to pay this, huh?
Can you hear me? Thank you.
Then you have to pay this amount in order to reach your deductible, but not everything you do counts towards that amount. We get to arbitrarily decide what we will allow you to contribute to that deductible fund and what we will not even consider.
And it's so funny too because it's the insurance people who are deciding that stuff and not the medical people.
Of course, because it's all about the money.
It's all about the money.
It's a business, and at the end of the day, all businesses care about is money.
It's that cash green.
It's that cash money, yo.
Cash money, yo. So you can see any doctor if you have insurance.
Incorrect. Red is bad?
Oh, sorry. You can see any doctor if you have insurance?
Mm-hmm.
I would say that's false. Yes, red is bad.
That is correct. So some plans restrict you to a network, and seeing out-of-doctor providers can result in higher costs or no coverage.
Yeah. I mean, that's the thing, right? Like, that question is kind of weird because theoretically you can see any doctor, but they're not going to cover it.
Yeah. That's a big thing.
Yeah.
Because I remember, like, going through my insurance and stuff like that. First of all, finding insurance, finding a doctor under your insurance is kind of like a hassle.
Yeah.
Because you have to look at so many different things. And, like, you would hope that all doctors would treat everyone equally, but that's not true.
No.
There's a big group of doctors who a lot of people, based off of reviews, say are very, like, unprofessional. I'm just like, why are they here?
Yeah.
For the paycheck.
For the paycheck, yeah, but
although they went through a lot for that paycheck.
That's why they go through it, for the paycheck, though.
But still, it's just such a hassle to get all this information about your doctor and someone that you're putting quite literally your life with.
Yeah.
But yeah.
Yeah, I agree.
Okay. Health savings account have long-term benefits.
Health
I don't know what that is.
Yeah, I don't know either, but I will say false.
I'm going to go with false, too.
So it's a true statement.
Okay.
So a health savings account is
a saving account for your
there's
health.
multiple different ways to do it, I think, but my best understanding, and I could be wrong, is that you have an option for each month of your paycheck or each pay period. You can take out a bit and put it into a health savings account. And it's not taxed at all. So you take that money out, it doesn't get taxed. And you can use it against any like medical expenses. So you can use it for prescriptions, you can use it for like Band-Aids, all that, usually anything you can find at like, your drugstore.
Is the point of having a separate account just for that, just because it doesn't get taxed?
Yeah.
Interesting.
And then as this says, HSAs offer tax advantages and can be used as a savings tool for healthcare or retirement expenses after 65. But I know like at my work, I'm pretty sure the funds expire at the end of the year.
What?
So you don't
That's
get those
so
long-term
silly,
benefits.
because what if you don't need it? I would think the point of having that is to save it up and to have a savings in case something big happens one day. Like, you can use it for little stuff, but if something big happens, you have that allotted that you've been saving all this time for.
Yeah.
So the fact that after that year's up, it's just like, oh, well, you don't have that money anymore.
Yeah, that's what I'm saying. I don't know if it's 100% always the same, because I know there's HSAs and FSAs, which is a flexible spending account. But but I know like there's a lot of women at work who they put money into the HSA or whatever we have, and they'll use it for their monthly products and stuff like that.
Alright.
But so when it expires, you just lose that money?
I think so.
Why would it not then just go back into your savings account? That's still your money that is being taken out of your paycheck to save for health reasons. Why is there even an expiration on that?
Unless you get some sort of like tax break on it, or
like that's so stupid. Yeah, tax the money and put it whatever you have left in the bank account if you don't use it for this specific thing.
Yeah.
Or don't put a freaking cap on it because that's stupid.
Yeah.
The point is you should be able to save up a
Money
sizable
doesn't
chunk.
just expire.
Yeah, what is that even? They probably just take it. They probably just take the money back and says, "Oh, you didn't use it because nothing bad happened to you. That's ours now."
Yeah.
So you get doubly screwed. Like that's ridiculous.
Because I know one year, I think at the end of the year, somebody was like, "Does anybody need anything from like Rite Aid or anything?" Because I have like $200 left in my account and I don't want it to like disappear.
Can you move that money?
I don't know.
That would be a good question.
That's so stupid.
I've never
though.
used it.
That's like literally a scam.
Yeah.
I mean, this is all a scam, but that is more specifically a scam because it's portrayed as being for you. But literally, if you don't need it, you lose it. Even though that's still your money that you earned from your paycheck.
Yeah.
And they just take it back.
I'm not 100% sure how it works, but based on what my coworkers were saying, that was my understanding, is that she had to use all the money.
That's absurd.
That is crazy.
Okay.
It's actually stupid.
Preventative care is only covered if it's truly preventative.
I'm gonna say that's true because that's very subjective to the person saying those things.
Only preventative. Yeah, I don't know. I want to go true too, but I don't.
So that's correct.
Yeah.
I kind of stopped keeping track.
Yeah. That's why I said like don't bother with it.
Well, you're mostly putting the same answers.
I have one more than Josh.
I know.
Yeah. Okay.
But yeah, if a preventative visit leads to a diagnosis or treatment, you may face additional costs because it's no longer preventative. You have something.
So stupid. So stupid.
Well, I mean, before
preventative.
Obamacare and what do they call it now?
Affordable Care Act.
Affordable Care Act. Because now that it's considered a good thing, we can't have Obama's name on it.
Sure.
But which even Obama said, he's like, once it becomes more popular, they will stop calling it Obamacare.
Yeah.
And they did.
Yeah.
But
He gazes into the future for that.
Before, I remember that was one of the big things around.
He knows how stupid works.
Huh?
I said, Josh says he gazes in the future, and I said, he just knows how stupid works.
Yeah. I mean, they're pretty...
consistent.
Yeah. Predictable is what I was going to say.
Yeah.
But I remember the big thing around 2010 when they were passing all of that and stuff was that at the time insurance could deny you stuff for having prior pre-existing conditions. And pre-existing conditions could be dumb things like very simple everyday stuff like allergies or whatever.
Or like you have an arm and you broke your arm, so that's a pre-existing condition.
I think that was part of the memes. But
I know, but like it's something.
Get your foot off the table.
I'm not rubbing it.
you're going to.
Stop.
But yeah, it's like, I don't know. The pre-existing condition thing is still an issue in a lot of healthcare stuff because it's still something people like to argue. It's like, oh, you have a pre-existing condition, so then we're not going to cover it. And it's like, why is that even a caveat? Like, why is that even a thing that if you have a pre-existing condition, you don't get healthcare coverage? That's something that you objectively need healthcare coverage for.
Yeah, well,
it's still a health condition that you have. Why does that get excused? You know why? Because they have to pay more. And any excuse to not pay is what they're going to go with.
Because they only wanted healthy people to pay for insurance who aren't going to use the insurance.
Exactly. So they just get a rake in the money and they don't have to actually pay it out.
Yeah. It's all done.
It's all done.
Medicare covers all healthcare costs for seniors, while Medicare... Oh, no, that's the whole statement. And then there's the next
Okay,
one.
what was the statement before you
Medicare
continue?
covers all healthcare costs for seniors.
I don't
False.
know. That's probably
Yeah,
false.
why
All?
would they? Yeah, all.
Yeah,
That's
no
too
way.
much.
So while Medicare provides broad coverage, it doesn't cover everything.
Yeah.
Dental, vision, and long-term care may require additional out-of-pocket expenses.
It's so funny because the way that I'm thinking about doing this, because I know nothing about medical stuff, but I'm just thinking like if it's too good, it's not true,
Yeah.
and that's really what it comes down
If
to.
it sounds like it's something it should do, it's not gonna do.
Exactly.
Yeah.
Which is so dumb that that's how I'm thinking about it and getting most of these questions right.
Yeah, because that's true. Because our system is broken and it doesn't work.
Yeah.
Well, it works if you're an insurance company and you want to make money. It works great. But if
Yeah.
you're a person who exists in this society, it doesn't work,
Yeah. Funny how that works.
isn't it?
Emergency service costs more even in network
Costs more than what?
than out-of-network.
I would say I would
I don't
hope
know.
that's false. And so I'm gonna put false, but if it happens to be
I'm
true,
put
that's gonna be
false, too.
annoying.
It should cost less out of network.
You would think so, wouldn't you? You might visit in a network emergency room, but still receive services for an out-of-network provider like specialists or anesthesiologists or who knows what.
Yeah.
So
stupid.
because the hospital could partner with an insurance company, but the doctors working inside don't, which is really, really stupid.
It's
How-
confusing.
It's just part of the system to make more money.
Yeah.
It's just tricking people because they know people aren't going to do all that research. And what choice do you have anyway?
Yeah.
Right? You go to the nearest hospital. Most people don't have 25 hospitals to choose from in a certain area. And if it's an emergency, you go where they take you. Like, you don't
Yeah, 911, they go to the nearest hospital.
Yeah, you don't
Yeah.
get say in that, so then you get stuck with whatever you get stuck with.
One up in Santa Clarita, we have one
We
hospital.
have one hospital.
For
Yeah.
200,000 people.
Yeah. There's one hospital here.
Meanwhile, we go 5 minutes in any direction, we probably hit a hospital.
Yeah. I thought you were gonna say here, where you go any 5 minutes and you see some church.
I mean, that's true
also
here.
Yeah. That's what I was.
That's
referring
also
to
true
here.
near you.
No, I was referring to here though.
Yeah.
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 You won't
LA?
you won't see a hospital for miles, but you bet your sweat deeply that you'll see a church or two.
Absolutely.
Yeah. LA has hospitals and Santa Clarita has churches.
Yeah.
That tells you.
And not the good version, like the band. You know?
Oh, yeah. With the
The V.
churches. The band. You know?
The version.
Okay,
They did one of the world songs.
You know all of those, right?
Sure. Yeah. I'll just not agree with you guys.
Yeah.
You only need health insurance if you're sick or injured.
False.
You only need. I mean, that's false. Yeah.
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 You need health insurance, otherwise you're gonna get.
It also provides access to preventative care and protects against financial risks of unforeseen medical events.
Even though
I
it's
don't
still-
think that's true.
Huh?
I don't think that's true.
You don't think what's true?
That they're there for unforeseen circumstances.
I mean,
That's
that's
what it is there
theoretically
for.
what it
I
should be for,
understand.
but the problem is, as we've been talking about, the insurance companies get to decide what's unforeseen.
Yeah, that's what I'm referring to.
Which is, again, absurd.
Well, I mean, I think the hardest thing is always, like, you know, the stuff we deal with on the day-to-day, but meanwhile, like, if you get in a car accident and you're injured, I think I'd like to think that they're usually pretty good about it. I haven't had to
so.
deal with it firsthand.
Yeah.
But
God
you
forbid.
can't really question any of the care you get in that point. Everything the doctors do should be seen as essential.
Well, and that's what I was saying about, like, how when you get in an accident, like, you don't decide what happens from there.
Yeah.
But then you still get charged for it. Whatever is decided, whoever is treating you, oh, it's not a network, oh, it's not this, it's not the right hospital, oh, we don't work there. And it's like, it shouldn't matter where you go, what doctors are seeing you, and what they do. It should be covered.
Yeah.
Just flat out, period. And the fact that it's not is absurd.
Yeah, I agree.
That is you cannot call it health care if you're not caring for the health of people. Yeah, I know you're listening, Big Pharma.
Insurance plan can deny treatment for not being medically necessary.
Oh, that's so true.
Which one's true?
Yeah, black.
I still don't know.
Yeah.
I just look at Josh.
That is true. Even if your doctor prescribes it, your insurance may deny coverage if it doesn't meet their criteria.
Yeah.
This has happened to me many times for medications that my doctors are like,
Yeah.
oh, we think you should be on this. And then the insurance is like, well, actually, no. And I'm like, none of their doctors talk to me. Like,
well, why does the insurance company get to ultimately decide whether what a doctor prescribes is true or not?
yeah, a doctor who met with me and understands my history apparently knows better than this guy who's just looking at a file.
Yeah.
Like, I had a telehealth visit the other day with this guy, determined that from my file I am a young, healthy man, and that any of my ailments were due to stress.
Yeah, that's absurd.
And I was like, okay, goodbye.
Yeah. Like, the insurance company should not get to decide whether the doctor and whether their prognosis and prescription is accurate or not.
Yeah.
You didn't go to medical school. You are not a doctor. Why do you get to say in whether you need this or
From
not?
my understanding is the insurance companies do have doctors on staff.
Yeah, but they're paying them though, so they're biased, and of course their
Well,
job
yeah,
is to be like, oh, you don't need
But
this.
you said they didn't go to medical school. They do have people who did.
Okay, but that's not the point though. The point is they don't get to decide what a doctor says is what my patient needs this medicine. The insurance company should not get to say, no, I don't think they need that. So I'm going to say no on that.
Well, the insurance
My doctor
is just saying, I'm
prescribed
not
it
covering it for
because
you.
I need it.
Yeah.
I mean, I'm not saying it's right.
Why are
It's
you
fine.
defending insurance
I'm not. I'm
companies
just
right
saying
now?
don't give arguments that are wrong.
How's that wrong? How is that wrong? Insurance companies should get to decide that doctors are wrong?
No, he's saying that
I'm
they
saying
have
the part I already
doctors.
corrected you about was wrong.
Okay, yeah, they have doctors on payroll, but they're paying the doctors to say no.
Yeah.
So that's not actually being a doctor.
I'm not defending the insurance.
Sounds like you're defending insurance.
Just arguing against your misinformation.
It's not misinformation. Because they're not acting as a doctor in that situation. They're acting as a surrogate of the insurance company to deny and say, this person I don't know anything about, I don't say that they need
your
it.
statement was
So why
just
do
they
they
didn't go to med school, they don't have degrees. That's all I was correcting you about.
Yeah, and I already acknowledge that, but I'm saying they're not using those degrees. They're listening to what the insurance company is telling them, say no to everything. That's not using your degree. That's not using your medical knowledge. You are not that person's doctor. You do not get to decide whether another doctor is saying what they're saying is true or not.
I mean, I don't think it's fair to just say every doctor that works for insurance's just goal is to deny everything.
That's fair.
Like, because there's a lot of doctors that, I mean, even with Dad's surgery, you know, he went to 2 doctors that were ready to do his surgery. Hospital was in-network, doctor was in-network, hospital was out-of-network. That's why he had to keep switching. Now his new doctor doesn't even think surgery is the right option. So, I mean...
Yeah, but that's the doctors. That's not from the
I
insurance
wasn't finished.
company.
I wasn't finished. I was breathing. But, you know, the doctor at the insurance company is like a second opinion. Dad ended up getting a third opinion that swayed the course of his treatment. You know, this is another doctor who's just giving their opinion. but it doesn't line up with the doctor that you met with, which does suck because if somebody's gonna make a decision about your care that's gonna impact your quality of life, they should have to meet with you and understand what's going on instead of just reading anything put on a file, because most of the files, I mean, I don't know what insurance gets to see. They probably don't get to see my home my chart. They just see my stats and that I was prescribed a medication. And they just see like bullet points.
Yeah.
But they don't know everything.
That's what I'm saying. Why do they get the final say?
Yeah.
Yeah, that's what I've been saying this whole time.
Okay.
Next question.
The ACA eliminated all out-of-pocket expenses.
What is ACA? Yeah.
Affordable Care Act.
Oh.
So I don't know what that is.
Eliminated
Obamacare.
all out-of-pocket expenses? That's incorrect.
Yeah.
You are correct. It improved coverage and affordability, but individuals may still have deductibles, co-payments, and co-insurance. Your plan may not cover certain name brand drugs.
Also correct.
Mm,
Wait, what's correct?
the black one. It will not cover certain name brand medication. Yeah. It's a bad thing, so it's probably true.
Yeah. Many plans have formularies that prefer generics, and you might need prior authorization or pay more for name brands. You may change your plan at any time. We kind of went over this already.
Yeah.
What bad red?
Bad red.
Bad red.
You're not required to take your employer's health insurance.
That's true.
You're not required. Yeah, I would say that's true. As long as you
It
have
is true.
insurance.
Huh?
As long as you have insurance, that's all that matters at the end of the.
If you find better options on the marketplace or your spouse's plan, you can always opt out of your employer-provided insurance.
Yeah.
Which I want to take this second to say, I have tried to opt out of my employer's insurance. They re-enrolled me without telling me, and then it caused me so many problems and $2,000 to $3,000 that I had to give back to my other insurance because they were like, oh, we weren't supposed to cover you because your employer's insurance takes precedent. And then it has to go through them first. So even though we were paying for double coverage, I really had like no coverage because the bronze plan came first, and I had to meet all criteria for that plan before I could. My parents' like gold or whatever level plan would take effect, even though I didn't want the bronze plan because it was crap. And that's the one that was provided by my employer. But I asked to be unenrolled, and they did not do that. But they never sent me anything to re-enroll, but he just resubmitted the paperwork because this was during COVID. And I never signed anything. And, yeah, I mean, I don't know what I can do about that at this point, but it cost me a lot of money.
That's annoying.
Yeah.
And stress.
Yeah.
Yeah.
That's a pre-existing condition.
So it's not covered.
Yeah. Let's see. Free preventative care is only for in-network providers.
Didn't we decide nothing was free?
Yeah. Nothing is free. Everything's permitted.
That's actually a true statement. Preventative services are only free if they're provided by in-network doctors. Out-of-network will always result in a bill.
Mm-hmm.
But I thought you always had to pay co-pays.
So
But this is for out of network, right?
this is
No, this is for
no.
in-network.
In-network you usually have co-pays too.
Yeah, that's.
So usually you get, as part of preventative care, can require some like tests and screenings and stuff. So like for women over 40, I think it's like mammograms. For men, it's like prostate exams. And then also like your yearly physical is considered a preventative care, which is why you don't get charged for your yearly physical.
I wouldn't know. I haven't had one in years.
Yeah.
But yeah, so
You don't even have to do co-pays for those?
no,
Oh. Just walk in, walk out? Wow.
with insurance,
Yeah.
because your insurance covers the preventative portion. But usually in those ones, they even on the piece of paper it says like you cannot talk about chronic illnesses.
Because then that makes it
Not
pre-existing.
preventative. Yeah, it's now just dealing with your.
It's so stupid.
Mental health services are often underutilized.
Are they even offered? I mean, that's true.
Yeah.
But are they even offered?
Does yours offer mental health stuff?
I don't know. I'll have to look into that.
But that is a true fact. Many plans offer mental health benefits at the same level as physical health, but they're often underused.
But
Yeah.
is it the same level? Because isn't it usually like, oh, you can have like 3 telehealth sessions, and like that's kind of
No, it's much better now.
Oh, is it?
Regardless of, I feel like it's just like people are not using them at all because
Well, yeah.
mental health in general is just not really like.
Yeah.
It's
But-
not really common, and even for me, for finding my stuff, like the Blue Shield website hasn't been working for the mental health stuff. I had to physically call somebody, and then they gave me a list of doctors and emailed it to me because they're on their website search was not working. So
Gotta
It's
get on
there.
that.
Huh?
They gotta get on that,
Yeah,
but they won't.
Urgent care might be cheaper than the ER for many issues.
True.
It's true.
Yeah.
Non-life-threatening problems like minor cuts or infections can be treated at urgent care centers for much less.
Yeah.
Some preventative services are age-specific.
Probably.
Some what are
Preventative services are age-specific.
Oh, yeah, that's probably true.
Yeah. So things like I just mentioned, like services like colonoscopies or certain cancer screenings like mammograms or prostate exams would be covered once you hit like a certain age.
When are you supposed to get a prostate exam?
I have no idea. Ask Siri.
Hey Siri, when do you get a prostate exam?
When do you get a prostate?
Hey Siri, come back.
She's like, I don't want to talk to you anymore.
She keeps going away. She's like, I know what you're gonna ask me.
She's on here. Hey Siri. She's not gonna reply to me.
Okay, whatever.
Hey Google, at what age do men get prostate exams?
According to Cleveland Clinic,
Cleveland.
according to the American Cancer Society, men and people who were assigned male at birth, AMAB, should have their first prostate exam by age 50. If you have a family history of prostate
That's
cancer,
all I need to know.
you should consider having your first prostate exam at age 45.
Okay.
Cool.
Yeah.
Thanks, Google.
And
And
then
Cleveland.
last one, insurance plans can vary by state, even from the same provider.
Yeah, obviously.
Yeah.
Yes.
Yeah. No one state has the same.
All that power.
No
Yeah.
one state fits all.
Yeah.
Which is silly, but it's so annoying because like when we have our lunch and learn about our insurance every year, they're like, you have to make sure that you're in California, and if you go out of California, it's gonna you have some coverages but not as much and all that stuff, so it's really annoying.
Yeah, it's like car insurance and everything.
Did you guys learn something?
No, I know insurance sucks. already.
Yeah, insurance, like I said in the midway of that, it's like, if it sounds too good to be true, it probably is. And that's sadly how it is for the most part, and that sucks.
Yeah.
I wish it could just be as easy as like, alright, you have insurance, alright, it covers this. And that's it. There's no argument.
Okay, let me ask you 2 more questions.
Okay.
Paddle's ready.
I already had them up.
I already had them up.
Medical insurance includes vision and dental.
Medical?
bad.
No. That's
Correct.
That's its own separate
Despite
thing.
also being a part of the human body and treated in a medical capacity and learned about
By doctors.
during a doctor program in medicine, they are considered separate for some dumbass reason.
For some reason, yeah.
So they can make more money.
Yeah.
It always
And
comes
so-
down
okay,
to
so-
money.
So what brought all of this and why I want to talk about it is for when I've had a lot of issues with insurance, and I feel like a lot
Which
of
is
people
often.
don't know a lot about insurance or how it works,
Please do,
and it's
Ryan.
really
I
stupid.
don't know.
Go ahead. You're taking away from what his
sorry,
series
sorry,
was.
sorry.
I mean, he was just distracting on the side, and then you start talking over. But
Okay, we're here. We're here.
and a lot of people I feel like don't fully understand insurance. Like every year during open enrollment, a lot of people at work ask me questions about it, and I'm like, I am not the expert. I've just had to deal with my insurance a lot.
Though.
But it's so difficult. But yesterday, so I found out that like this year my insurance was swapped from one provider to another. But it wasn't clear to me, and I didn't get a new card because apparently it's under the same member ID as my medical because they're the same provider now. But then when given Blue Shield, like my member number, because they're now my vision and my medical, they weren't able to find me apparently because while they're like the provider, it goes through this third party, I guess, called like iMed or whatever. And even though my optometrist office is in network for Blue Shield Medical, they're out of network for iMed, who's under Blue Shield.
Yeah.
And so if I got something in my eye and had an infection, they would bill Blue Shield for my insurance.
Because that's medical.
Because it's medical.
Mm-hmm.
But just for needing glasses and stuff, or getting an eye exam, that's not considered medical, so I would be out of network and I had to pay myself.
Isn't that
And I'm like, that's
absolutely
so
ridiculous?
dumb and arbitrary, and the system is broken. And I assigned to the front desk lady, and we've been going there for like 20 years now almost.
Yeah. As long as we've been living here.
She's just like, yeah, I feel so bad for clients, because you guys don't know how insurance works and everything, and I feel like everybody's just always hit by surprises.
Yeah.
Well, because there are surprises, right? Like, if you are getting your insurance through this company, you should be insured through that company. And if they're in network, like, why are there third parties that are like not in network? And so, technically, then it funnels through
it's
this
like,
path.
It's like his old insurance, which said
so-
Nippon Life Benefits, but it also said Aetna.
Mhm.
So we didn't know, and I was able to sign in on both websites as him. But when he tried telling somebody he was under Aetna, they were like, "We can't find you."
Yeah, we don't.
But then
know
they
who
found
you
him
are.
under Nippon, but then Nippon says he's not covered for stuff, and
It was a whole convoluted thing because there's a lot of he said, she said. I'm just like,
Yeah.
I don't know either one really at this
you're
point.
like, I have insurance.
But I feel
I
like
have
that's
insurance.
part of the point, though. Is
Okay.
You confuse people enough, and then it's just too overwhelming, and they don't want to deal with it, so they just pay.
Last question.
Mhm.
Insurance is not meant to protect me, it's meant to make sure I don't go bankrupt.
I think theoretically that's the case.
Yeah.
I would argue it doesn't
should
do
be.
either, but
It should be, but I don't know how it works.
So,
at this point.
I'm pretty sure it's true,
Yeah.
Yeah.
because this is from me, and this is something that Dad always tells me whenever I complain about insurance, because he's like, insurance is just there to make sure you don't go bankrupt. Because what it does is, like, yeah, you pay your set premiums every year, and then you have your deductible that you have to reach, and then after that you have your out-of-pocket maximums, which are usually like a couple $1,000.
Yeah.
And then once you hit that, you're not supposed to pay anything else.
Supposed to.
So technically, after let's say my deductible's $500, my out-of-pocket maximum's $2,000, and then my premium, maybe I pay $200 a pay period, which is about, that's a lot.
That's over. I mean, even just that
That would
$2,500 is a lot for some people. Like that.
Is that that's like $5,000 a year for the
Yeah.
So $400 a month would be $5,000 a year almost.
Yeah.
So that would say at most per year I would spend $7,500 on medical,
Which is a big chunk of change.
which is a lot of money, but it wouldn't bankrupt you.
It could. If you're working like a minimum wage job.
Sure, but it shouldn't bankrupt you is the idea. Because like if you were to get those medical bills straight,
Yeah.
it'd probably be so much more than that.
Yeah.
So I think that's the idea and the overall purpose of insurance companies, but it's just annoying because it feels like they just don't cover a lot of stuff, and because it's so unclear and there's so much like red tape and bureaucracy behind everything, and like corporate greed is such a rampant thing in this country, and so many other countries have like healthcare for all or systems that like don't seem to have these problems.
Yeah. Well, that's
It's
the
just
thing
so
is,
annoying.
In those countries, like, I hear one of the biggest complaints I hear from countries that do have, like, healthcare for all or the single payer method or whatever it is, where healthcare is more accessible and you don't have all these insurance companies. One of the biggest complaints I hear is, like, wait times can be kind of long, right?
Mhm.
Because people are actually using the services and able to get in. But, like, I've heard so many stories, too, of, like Markiplier when they would go on tours and stuff, and when he's been in Korea and whatever, like, he got like an ear infection, and at like 5:30 went to a hospital, just walked in, doctor saw him right away, like examined his ear, he got medication. It was out in 20 minutes.
What
Yeah, medical tourism is like a huge thing. Like I know plenty of people who have planned their trips to like Korea or even Japan and stuff.
Even to Mexico.
Yeah. Oh yeah, healthcare tourism. Yeah, there's a large hospital in Mexico that where one of my coworkers went to get a procedure done. I think there's a huge place in like Hungary or Turkey, somewhere over there. It's like a huge medical like city, which is basically for medical tourism, and a lot of people do this stuff. And you get there and you get treated so well, and they're like, these people don't speak my language, but you get like a translator.
It's
assigned
like high
to you.
quality. You're in and out. You get what you need.
You're
and
well
you
taken
don't
care of.
have to pay anything.
Well, and for some people, they're like, the cost of flying there and even paying for my treatment there was cheaper than if I were to do it here.
Yeah, and that's absurd.
Yeah,
and
like that you can fly halfway across the world, and that's cheaper than going down the street.
And sure, it is scary to go to other countries and get medical procedures done, because I think there's also a conception that's like, oh, you're going to Mexico to get your surgery done, like, that's going to be botched or whatever.
Right.
But I think, you know, as long as you're going to reputable sources, because I think the one I saw about Hungary, somebody found it through TikTok, and then I saw it on, like, a YouTube short, and they were talking about how they saw somebody else who had got this done on TikTok and was, like, promoting it as, like, oh, this is, like, a great alternative, like, a more affordable option for me, even though it is so, like, far away.
Yeah.
Because healthcare in America is expensive, and some people don't have plans that have $500 deductibles. It's like $2,000, and the out-of-pocket maximum could be $10,000 because they're on a bad plan, and you know, it's just really, really hard.
Yeah.
So maybe when we go to Japan, if you want, you can get your LASIK done there.
Yeah, I'll do it over there.
Yeah.
I hear it's great.
Yeah.
I hear I can get great eye surgery and be in and out in like an hour or whatever, and then be good in the next like 3 hours or whatever.
Yeah.
A lot of people go to like Korea and Japan for like a lot of beauty stuff, and and eye surgery falls under beauty.
Yeah.
So.
But like even in Europe,
see.
I've heard a lot of stories of like
I just come back with perfect eyes.
Yeah. Hey guys, I can see.
Yeah, I can see you guys.
Of like just like, you know, you get sick and you need to go to the doctor, and the doctor just sees you and you're in and you're out, and you don't have to pay anything, or you pay like, you know, $10 or whatever, because medication is also more appropriately priced instead of the price gouging that happens in America, which that's a whole other topic, but it is related. Yeah. And it's just like, there are systems out there that work better. And are they perfect systems? No. But just like anything else, you need to start doing it first, and then you work out the kinks. Like saying, oh, well, that's not perfect, so we're not going to do it. We're just going to stick with what we're doing. It's such a flawed argument. That's a freaking oil argument.
When even here, like, most of the doctors I've tried to get an appointment with recently at UCLA, it's all 3 to 6 months out. Yeah. Like, it's not like I'm getting an appointment next day or anything.
It's so annoying that it's 3 to 6 months out.
It's always 3 to 6 months. It's
I told Josh to make an appointment 3 months ago, and he didn't, so now he still has to be 3 to 6 months out, but...
Yeah, it's okay. I'll die.
Yeah. No. Stop.
But see, that's the mentality, right? And I know that's a joke, but that's also, like, that's just a lot of people's... Like,
it's like,
reaction is like, I'll be fine. Like, I don't want to deal with the insurance. I don't want to deal with the wait times.
Well, that's why he would never go to the doctor under his last insurance. He's like, I don't want to deal with it.
That was a hell of an insurance.
But that's all part of it, though. Like, it doesn't.
And even then, it was difficult.
Sorry,
Brian. Go ahead.
No, it's fine. It's just like that's the whole thing, and I think that's part of the point is they don't want you to use your insurance because they want to just make the money from it. Yeah. And if you use it, then eventually they're gonna have to pay for it. Even though they put all these stops in place before you get to that point, eventually you will get to that point where they will have to pay something, and they don't want to do that, so they make it as difficult, as complex, and as many levels as possible before you get to that point, so that you just don't use it and you just pay them every month and they make their money.
And to tie it in, and I know it sucks because I don't have like the exact stats in my head or stuff.
Just make them up.
But to tie it into like politics and stuff, because it is an election cycle, you know, the Biden-Harris administration right now, they really have been working hard to try to lower costs of healthcare in America and lower prescription drug prices and stuff like that. So, I mean, it is nice to see that, you know, advancements are being made and these people will, you know, negotiate with our government. If our government's willing to work for the people and do what they can, because, drugs like, you know, just insulin and stuff that people need every day, for ailments that they don't choose to have or anything
Yeah.
shouldn't be so expensive. But so it's nice to see some progress on that.
Well, and that's the thing that reminded me too is like if you have something happen to you, like you get cancer or like you get some kind of illness or some kind of injury or some kind of diagnosis, I feel like at this, like today, using crowdfunding sites to raise money for these kind of treatments and stuff is more effective than insurance. And that should not be the case. Like, if insurance exists, that should be what that's for. Like, you shouldn't have to go and ask strangers around the world to give you money to pay for your problems when you have insurance. But that's often a better option because insurance doesn't do what they're supposed to do.
It's so funny because it's one of those stories that's like, it's so nice that people are willing to give up their own money to help somebody.
Yeah.
Often, sometimes even a stranger. But at the same time, it's like, that shouldn't have to happen.
That shouldn't be the case, though. Not
Like,
when we live in the richest country in the world. We shouldn't have to be paying each other.
Like, one of my friends, his nephew died in an accident recently, and they did crowdfunding for the funeral and stuff. And I'm like, a funeral for a child shouldn't be that expensive. Like,
that's a whole other conversation.
That's
how expensive dying is.
Yeah, I mean, dying in general shouldn't be that expensive, but it was just like this poor little guy, like, and now his family's just burdened with with super high medical costs.
Yeah, and funeral costs too.
Well, yeah.
It's all expensive. Everything is expensive, and it doesn't have to be.
It's expensive to live. It's apparently expensive to die.
Yeah.
Can't escape capitalism.
Can't escape it. Well, you can, but the other people will have
You
to
can,
suffer.
but you'll dump your problems on somebody
Yeah.
else. No, never mind. That's a cruel joke.
Just cremate me. Just burn me alive.
Funeral
Alive?
Yeah, alive. Just burn me.
Okay.
Funeral pyre.
Funeral. What? Yeah.
Yeah. Do you want a Viking funeral where we shoot flaming arrows?
Yes.
Yeah.
Yes.
Send you
That'd be
off
so
on a
cool.
boat.
Yeah.
Do you want us to do it in the SoFi Lake?
Yeah.
Okay.
Yeah.
Do you really though?
It's the
You
closest.
can pick
way.
anybody.
It's close to home.
It's the closest. I don't want to inconvenience anyone. All my family's near there.
Okay.
That's my
As long
mind.
as I can shoot a flaming arrow.
Yeah.
can't give
But
it-
you have to aim it at the first shot. If you miss, you have to start the whole ceremony over again.
It's gonna be a while.
No, you better
I
practice
work on
beforehand.
my archery skills so I get it just right for me.
Like the moment I hit the hay or whatever, I hope you have had so much training.
I'll make sure that I become an expert marksman just for you, Josh.
So why are you here for archery lessons? Like, I made a promise to a friend.
I need to light his Viking funeral when he dies.
Meanwhile, Josh is gonna outlive both of us.
Yeah, probably.
Nah, I'll probably die. No.
He just won't remember us.
Yeah, I'm probably gonna get dementia at some point, which is scary.
That's the spirit, buddy.
Well, it runs
That's
in
all
my-
he tells me.
Oh, does it?
Yeah, that's why I say it. It's like I'll probably start forgetting people.
It was your grandma, right?
Yeah.
Yeah. Well, we'll see how your parents age.
Yeah.
Hopefully, well.
Hopefully.
Gracefully, probably.
I mean, my mom's living it up right now, so.
Yeah, she traveled the world with her new best friend.
Mm-hmm.
Besties for life.
But yeah, anything you want to talk about your insurance woes, or did we cover them?
I mean, yeah, just talking about the whole, because I worked for like a Japanese company, and they got Japanese insurance that have like a location here in America. And, it was this whole thing called Nippon Life Benefits. You know how many people know about Nippon Life Benefits?
2.
Yeah, and I'm one of those too.
I'm the other one.
Yeah, exactly. So the amount of people were like, I have to show them my card. It was always just a thing like, hey, yeah, I have this insurance. I know you probably don't know what it is. In fact, I know you don't know what this is, but it's good, I'm sure. And they're like, what is this?
It's good, trust me.
It's called Nippon Life Benefits. Like, what is that? Like, I know. And it's such a hassle.
Well, it's funny because they
tell people, like, hey, I have this insurance that you probably never heard of. That's in my statement.
Sorry. It's funny because they do have like a major health insurance logo on it too, because they have the Aetna logo and symbol and everything. So it's like, even if they don't know that, it should be backed and considered part of that network. That's why it's on the card, right? But no.
No.
Otherwise, why would it be on the card?
No.
We don't know.
We don't know.
We're the two people that know about it. We don't know that.
Yeah.
And if you don't, who else will?
What about your insurance woes?
I don't have it because I'm a student and not working.
You don't have insurance through school?
No, I mean technically I do, but it's new. They're just rolling it out like recently, and I don't know what my plan coverage is because every time I look it up, it says coming soon.
Oh, that's fun.
So technically,
And you don't qualify for Medicare or anything because you're unemployed?
Probably because I'm unemployed, but like...
You don't want to sign up for it?
Nah.
Why not?
Because I'll get a job soon.
In a year?
Because again, here's the problem. It's just too much. It's just too much. I'm fine. I'm healthy right now. And if something happens, whatever. But I'll get it eventually. It's just too much work.
The American mindset. If something happens, it happens.
Yeah.
I mean, you should sign up. Because, I mean, it's going to be...
Well, I have Medicare, I think. But, that was the problem, is because none of the doctors up here is covered. So I would have to go, like, 30, 40 minutes somewhere else to get coverage, or to go to the doctor, and I'm like, I don't care enough.
There's nobody in Santa Clarita?
No, there's not. Like, literally the closest one, because I tried going to UCLA, because I'm like, I have insurance, and they said, like, yeah, we take Medi-Cal or whatever, and I went there, and they're like, we don't do this. You gotta ask for, like, here's a list or whatever, and you gotta pick one of these doctors, and the closest one was like 40 minutes away.
That's because you're in an HMO, probably.
I don't know what it is.
Well, because HMO is you have to pick, like, a specific doctor. You can't go where you want.
But the closest one was like 40 minutes away, and I'm like, I'm fine.
Yeah, I don't need to.
So that's what it was. I do technically have insurance, but it's bad and it's too far away.
Yeah, it's too convenient.
That's why I haven't been to the dentist.
Yeah. I just pay out of pocket for it.
I tried to go back to... How much did you pay last time?
It was like $200. Yeah. Yeah.
Which is not the worst.
When was the last time you went?
May.
Do you have an appointment in November?
Yeah, but I don't know if I'm going to go back because they got rid of our girl.
They did?
Yeah.
Eliza?
Close. Alyssa.
I was going to say Alyssa.
I was like, that was close.
Yeah, that was close. That's why I said close. That wasn't sarcastic that time.
No, I know, but I'm just like, wait, was that her name? Like, because I haven't seen her in so long.
Yeah.
I wonder where she went.
I don't... okay. Tea time.
Oh.
Tea time.
Shit, where'd that mouse go?
The mouse in excitement.
It's over there.
Yeah, it's fine, as long as it didn't unpause.
So basically, the dentist... I learned so much about dentistry. So the dentist... I did, seriously.
You know how to do crowns and everything.
It's not that kind of...
No, he knows the codes for how to
do
crowns.
I wish. Okay, so... Buckle up.
Buckle up.
Okay,
Get
so
all cozy.
one thing I've learned in the past talking to Alyssa. So Alyssa was our hygienist, and so the dentist we went to was technically a kids dentist that we had gone to
since
we were kids, pretty much since we moved up here. And the original dentist, great guy.
He used to have this room of like Star Wars statues and stuff.
He has all this like haunted mansion decoration and like original Harry Potter movie or book posters. Like even it says Philosopher's Stone before they changed it to Sorcerer's Stone. Mm-hmm. Like a bunch of cool memorabilia. Super cool dude. Like really nice guy. Shout out Dr. Singer. You're still around. I think he's in Kentucky now or something.
He doesn't live here anymore?
No.
He used to live in our neighborhood.
Yeah, he's super cool dude. He then retires, gives it to Dr. Bobby, who's a nice guy. He's fine, whatever. But this is
He used to love Dr. Bobby.
No, Dr. Bobby's fine. I don't have a problem with Dr. Bobby. But what the point of the story is that it's a private practice. Mm-hmm. Now, some things I've learned about private practices is they do not give their hygienists insurance.
Oh yeah, I remember her talking about this.
Mm-hmm. So the hygienist there... Okay, so to just let me be more fluid about this. So we went there as kids, and then when you get to like 18 or whatever, you can't go to a kids dentist anymore. So we didn't go there for a few years. But then they brought on this woman named Alyssa, who was like the adult hygienist or whatever, and she was like using new technology, like these cool like water brushes or whatever, testing stuff out, but then was accepting like older patients. Right, and so they let us go back for a little bit.
It was to give kids who were like aging out of child pediatrics but didn't need adult care like crowns and all that stuff. It was like for the middle ground where you still just need like basic cleaning and stuff like that.
Yeah.
And then if they saw anything bigger, they'd pass you on to an
they
adult.
would like refer you to an adult dentist. But as long as you didn't need any of that stuff, you could, we were allowed to go to Alyssa, and she was great. And I was talking to her, and she told me that she doesn't have medical care, like she doesn't have insurance or anything like that. And I was like, so how do you clean your teeth? And so she was saying that they, like the hygienist, and like
background,
they exchange favors. They'll be like, I'll clean your teeth, you clean my teeth, sort of stuff. I'm like, but you clean teeth for a living. How do you not have dental insurance? And she's like, if you work at a private practice, they don't pay for insurance for their employees. So they don't have insurance. And what happened was she got carpal tunnels and needed surgery. And so she quit because they weren't covering it. And so she is now working somewhere else where she can get insurance. I don't remember exactly because I was talking to the front desk lady. Mm-hmm. Because when I went last time, they had a new lady there who was not as nice. I mean, she was like friendly, whatever. She's Dr. Bobby's mom. Yeah.
Nepotism.
Yeah. And she was like she was a nice lady, but she was no Alyssa, and like didn't do as good of a job. Was like very harsh, like in the cleaning process. Mm-hmm. Whereas Alyssa was super great. And so I talked to the front desk lady because the front desk lady knows our mom is Sandy. Oh. And so we were talking, and I was like, "Yeah, who's the new lady?" And she like literally like looked around and wrote on a note and passed it to me and says that she's her name is whatever, I don't remember. It said it's Dr. Bobby's mom, and I was like, "Yo!" I'm like, "What happened? Like, where's Alyssa?" And so she told me that she needed surgery. And they don't get surgery. They don't work at a private practice.
They don't get like regular medical insurance.
I don't think they get any insurance at a private practice because the doctors don't want to pay for it.
Yeah.
Yeah. So the only way you can get insurance if you're a hygienist is if you work at like a place like Smile Dental or like a major franchise, like major franchise. They offer insurance, but she was saying like the care there is not as good, right? So you kind of trade off like, do you work in like a nicer place? Or do you get insurance? So I don't know if Alyssa had found another job because I think she was still recovering from her surgery. And Sandy said she'd let me know if she hears anything, but I haven't heard from her, so I don't know if we know anything. But so she was still recovering from her surgery, so I don't know. But she left there because she wasn't getting insurance, and she's like, I need insurance. Like I just need this.
Yeah.
But apparently all private. I mean, probably I can't say all because I'm sure there are some dentists who probably do pay for their employees. But the standard practice is if you have a private company, you don't offer your people insurance or anything. And I'm like, so why would people work there then? And it's like, because it's a better environment and because, it's not just the old, like, bring them in, clean the teeth for 10 minutes and then send them out because you need to get...
But that's also highlights such a main problem with tying your insurance to your employee. Mm-hmm. Because, like... First of all, you could just be out of a job, there could be layoffs or whatever. You shouldn't have to lose your insurance because your company decided your position's no longer needed or whatever.
Yeah.
So, like, that's a huge flaw. But also just, like, what if your boss just doesn't want to offer it because they don't want to pay for it? Or, like, in most cases, because they could just tell you, okay, we'll sign you up for insurance, but you have to cover your premiums. But they don't even want to hire the person to do all the research and get the plans and stuff. Because, I mean, like, we have HR people for that. My last job, I mean, we didn't have HR people, but I'm sure CEO did that one time. And then every year he just goes, okay, what plans you got? Which ones are the 3 worst? All right, we'll offer them those. Yeah. And then, like... But he did pay all the premium, which was nice. So at least I didn't have to pay for my shitty coverage. But it was really annoying. But...
Yeah. So that's
it shouldn't be tied to your employment. And I mean, yeah, you can buy your own thing on the marketplace, but that's so much more expensive because like the whole benefit and the reason it's tied to employment in the first place is because that you have the collective buying power of like 100 people at the company, let's say, instead of the 1 or 4 people in your family or whatever. Like those 100 people have more bargaining power than 4.
Yeah.
But the flaw of that is those 100 people are not the ones bargaining. It's still whoever's at the top.
Well, yeah, it's like your HR person is... But, I mean, you're hoping that your HR is fighting for, your best interests.
What are they fighting for, Josh? Tell me right now.
The money.
The company, that's right. And the money. So they're going to use that power to still get the cheapest option possible and the least coverage possible. And it doesn't matter about the people.
Yeah, because I mean, also, I mean, there might be more money into it than just the premiums and stuff. Because I think, one of my HR people told me, you know, because we used to offer like 3 plans from Kaiser and like 5 plans from Blue Shield, and I would always do the highest plan on Blue Shield because while it had the highest premium, it had the best coverage. It was a platinum plan. It had a low deductible. I had very minimum co-pays, and I had no deductible actually, and then it was very low co-pays, and my out-of-pocket maximum a year was lower. And because I've been going to the doctor a lot, I was like, that sounds great, but they got rid of that plan because it was too expensive to offer more choices.
Right, of course.
And only me and a couple other people were on it, so they cut it.
Yeah.
I'm like, well, okay, thank you.
Okay, bye.
Can you just go to Blue Shield and get that plan anyway, or it would just be?
I have no
more
idea how
expensive?
much it would cost. Because I almost said my company.
Matt, have you said it before?
Have I?
Probably.
Probably. I don't know.
I don't know actually.
I don't know. Cut it out.
But
But at my job, they do pay partial premiums for the employees, so we don't pay the full premium. Because like if you notice on our when we sign up, it'll say like employee premium like $150 per pay period. Employee plus spouse, it'll be like $500 per pay period because that's the cost of the employee, so the $150 and then like $350 for the spouse because they're paying like half of mine. They wouldn't pay for half of my spouse's,
right.
which is ridiculous.
Yeah.
It's all ridiculous is what I've learned today.
Yeah.
But it doesn't have to be, which makes it even more ridiculous.
Yeah.
So tell us about your thoughts on insurance. Is it a scam? What are your woes? Do you have cool stories? Let us know in the comments down below.
We like stories.
We
Most
do.
days.
I like them all days.
Bye.
Bye.
Hey.